Hola, I'm Mae Silvestre, and I'm your student nurse. I will show you the steps of fetal heart monitoring using stethoscope. Fetal heart rate monitoring measures the heart rate and rhythm of your baby. This lets your healthcare provider see how your baby is doing. Let's begin. Identify the correct patient. Introduce yourself and state the purpose of the intervention. Like for example, "Good morning, Mrs. Cruz. I will be doing fetal heart monitoring in which I will check for the rate, rhythm, and the presence or absence of acceleration and deceleration of the fetal heartbeat of your baby. Is that okay, ma'am?" "Yes, of course." And don't forget to provide patients privacy. Do hand hygiene before touching the patient. Expose the part to be examined, keeping a cover on the other parts. And now, perform loopholes maneuver to locate the back. Second maneuver, which is the umbilical groove. Place the diaphragm of the stethoscope onto the client's abdomen where fetal back is located and count the beat in 1 whole minute. 2 beats are equal to 1 count. Normal result 120 to 160 beats per minute. Below or above this range indicates fetal distress. Assist client to get out from bed. And do hand hygiene after touching the patient. Don't forget to record your findings on the client's chart or record and report your findings to the attending physician.